Hey, hey, hey guys! Welcome to UWorld's Next Gen NCLEX review. My name is Nicole here with another question drill set. If you are new here and have never seen a question drill set, well, welcome in. How a question drill set works is I will read off a question to you, give you about 30 seconds to look over it, think about it, drop your answers down in the chat, and then we'll go over why the right answers are right and the wrong answers are wrong. I like to say put it in the chat because you can help other students that are in the chat, but then we also have Samantha here moderating for us today. So if I go a little bit too fast or you need some reiteration about one of the answer choices, she's in there to ask or answer all of your questions. And so without further ado, let's get started. Today's topic is genitourinary. I have a hard time saying that, so we're just going to say G-U, okay? So keep it easy and keep it simple with me. Question 1, the nurse is caring for assigned clients. The nurse should first assess the client who has what? Option 1, nephrolithiasis and hematuria. Option 2, acute kidney injury and an elevated serum potassium level. Option 3, a urinary tract infection and pyuria. And option 4, chronic kidney disease and a decreased glomerular, I'm not good at saying these long words, filtration rate. Let me know what you guys think in the chat. Tell me if I'm pronouncing, no, actually don't tell me if I'm pronouncing the words wrong because I know I am. But just let me know what you guys think in the answer or in the chat. I know it's been a week. I don't know if some of you guys have just come back from spring break or you're about to go on spring break. How are you this semester? What's going on? Are you coming back from spring break and feeling refreshed and ready to go, or are you dragging? I feel like this week has been dragging for me. Today is my Friday, so I'm like super excited for the weekend because I have nothing planned. And nothing's better than a nothing planned weekend, if you know what I mean. Let me know what you guys think. Lots of good answer choices in the chat already today. A lot of 2s. This is not a select all that apply, so it's only one answer choice, and it's a priority question. So which one do you think we should assess first? Like one might have a life-threatening situation going on, or potentially. Let me know what you guys think. Okay, yep, more of the correct answers, which is a lot of answer or option number 2, which is the correct answer. So when we think of, or with the question, how I like to break it down is looking for those keywords. So in the keyword, or the keyword in this question is first, which is making it seem like a priority. So I kind of think of it like, if you can only do one intervention, or if you could only save, in this case, one person's life, or if you're saving one person's life, that is immediately probably going to have some life-threatening complications. Which client would that be? Which would be option 2, acute kidney injury with an elevated serum potassium level. Acute kidney injury is when the kidney function abruptly stops, so your kidneys aren't filtering all your waste products the way that it's supposed to, and it's not working the way that it's supposed to. So some of those waste products and electrolytes that it's also metabolizing is potassium. And we all know that potassium is a very finicky electrolyte in our system, and if it gets too high or too low, we have serious life-threatening problems. And in this case, if it gets too high, we have more heart problems more likely, and then we'll have dysrhythmias and then sudden death and all that stuff. So we need to stop this or have intervention with this client immediately, because an elevated serum potassium would be our life-threatening thing that could potentially be a life-threatening situation. All the other options, options 1, 3, and 4, are something that we could wait, or an expected finding. Nephrolithiasis, which is just a kidney stone, and hematuria, that is blood in the urine. It could be an expected finding. Sometimes as that kidney stone is passing, you'll have a little bit of urine or blood in the urine, so that's slightly expected. Option 3, a urinary tract infection and pyuria. This is white blood cells or pus in the urine, so with a urinary tract infection, that's again usually likely to be seen. And then chronic kidney disease and a decreased GFR, I'm not going to say that long word, decreased GFR rate, that is again to be expected. You usually can diagnose CKD or chronic kidney disease with the decreased GFR rate. So again, hand in hand and expected. But what is not expected or something that would be an emergency is an elevated serum potassium level. But you guys did great. Good job, guys. Next question. The nurse is observing a staff member caring for a client who has an indwelling urinary catheter. The nurse should intervene if the staff member is observed doing what? Option 1, emptying the urinary drainage bag twice during the shift. Option 2, cleansing the client's perineum with soap and water after a bowel movement. Option 3, securing the catheter to the client's upper inner thigh. And option 4, maintaining the urinary drainage bag above the client's waist when assisting with ambulation. Let me know what you guys think in the chat. Drop your answers down. I see people already putting where they're joining in from because they know that's my favorite question, but I haven't asked it yet. So I will shout you guys out later. What I want to know right now is if we have any recent NCLEX passer or people that have just scheduled to take their NCLEX. I would love to give you a shout out right now and say congratulations or good luck, give you that little pump, that little dopamine thing to make you feel good about yourself. It's always nice to feel good about yourself, so let me know. We have someone on TikTok that just passed this month. Good job to you. Welcome to the RN life. We have some graduations coming up. Graduation is Saturday morning. Congrats. It's always great to walk that stage. Next step is passing that NCLEX. Miss Chelsea on TikTok takes her test in 2 months. You got plenty of time to tune into UWorld Lives and get the best study options here. Miss Lauren on TikTok takes her NCLEX in May. Good luck to you. You got a couple months as well. Tune in every week to us. I would love to keep pumping you guys up and giving you like good tips and good helpful things to look out for. Who else? Anybody else recently scheduled? Miss Queen Ali on TikTok just scheduled her exam. Whenever you take that, good luck. You got this. Okay. While y'all are putting your test dates in the chat, let's move on to the correct answer. Option 4, maintaining the urinary drainage bag above the client's waist when assisting the ambulation. So let's go back to the question and figure out what the key words in this question is asking. The nurse should intervene. So if we're looking for an intervene thing, we're looking for a wrong action. What is the client doing or the nurse doing wrong that we need to stop and give more education? So if the nurse is maintaining the urinary drainage bag above the client's waist, that would be a wrong action. A urinary drainage bag or a Foley is something that helps drain the urine. If it is above the waist, it can backtrack back into the client and then cause UTIs and more problems, and we don't want that. So it's always best practice to always keep it low and below the waist. All the other options 1, 2, and 3 are correct things to be doing and correct teachings that the nurse could be doing, such as emptying the urinary drainage bag twice during the shift, which is usually about 2/3 full. But then more if you see that it is getting a little bit more full. Option 2, cleansing the perineum with soap and water after a bowel movement. This is definitely needed. We want to keep that area really, really clean so we can prevent any caudis, which is a urinary tract infection that is brought on by that catheter. And then option 3, securing the catheter to the client's upper inner thigh. That is a correct thing, something that you do to kind of secure it into place so it doesn't tug and snag on anything and accidentally pull out. Yes, there is that balloon that is inflated in the bladder, but you also want some, a little double safety check and secure it on the client's leg so it doesn't go hanging or swinging anywhere. But you guys did good. Next question. The nurse is caring for a client with urge incontinence. It would require follow-up if the nurse is doing what? Option 1, Teaches the client pelvic floor exercises. Option 2, provides the client with a toileting schedule. Option 3, encourages the client to avoid caffeinated beverages. And option 4, instructs the client to empty the bladder every time the urge to void occurs. Let me know what you guys think. And if you're just tuning in, we are covering everything GU, so everything bladder, kidney, lower body, not lower body, everything GU related. So let me know what you guys think on this answer or this question, and we'll go from there. Oh, I see some people. Let's see if I can catch it. On YouTube, Miss Kavita is taking hers soon. I didn't catch the date, but good luck to you, Miss Kavita. Who else? Let's see. April 17th, that's when you're taking yours. Good luck to you. That is coming up in the next month. You got this. I think that's about it. But as always, make sure to like, follow, send this video off to all your friends, your classmates. We would love to get more followers day by day. We reached our 50,000 on TikTok. We would love to get 60,000 and more. The more that we can reach and help you guys and help the students, the more it makes my heart happy. So tell everyone, tell a friend to tell a friend. Okay. Oh, we have Miss Catherine Okafor on YouTube, takes hers June 10th. I hope you pass. I know you'll pass. You're tuning in. You'll do great. Correct answer, let me click back onto the screen. For this one is option 4, instructs the client to empty the bladder every time the urge to void occurs. So again, let's go back to the question. What are the keywords that we're looking for here that will make us choose the right answer choice? Requires follow-up would be our keywords here, which means, again, it's something that we're looking for is a wrong action. Requires follow-up, we need to stop the action. So we do not want to instruct the client to empty the bladder every time the urge to void occurs. With urge incontinence, the body is not triggering the client to use the bathroom at the right time. So they're going to the bathroom way more frequently than needed. Their bladder is not fully full, or usually only has like a little bit, but they get that sensation to go to the bathroom really quite often, usually like every 10-15 minutes, which can be a pain. So we can't trust our timing with our own body, so we have to train our bladders all over again to go to the bathroom at the right time, which is not every 15-20 minutes. So instructing the client to empty the bladder every time the urge to void occurs when they already have urge incontinence would be a wrong action, because they're already having that urge, and we don't want them to go to the bathroom every single time, because that's going to cause problems more to the bladder. What we do want to teach them is pelvic floor exercises and put them on a toileting schedule so that we can retrain the bladder to hold on to urine for a longer period of time and then completely empty it when the time is right. So options 1, teaching the client pelvic floor exercises and putting them on a toileting schedule. These will all help to recreate that bladder sensation at a higher level and longer period of time in between. And then option 3 is correct, because yes, we don't want to give them caffeinated beverages. Caffeine can sometimes be a diuretic, which can again increase the urge to go to the bathroom. And so we want to take away all the urges that we can, and so caffeine would be one of them. But you guys did pretty good on that one. Good job. Next question. The nurse is assessing a client with pyelonephritis. Which of the following findings would be consistent with the condition? So this is like a general understanding type of question of pyelonephritis. What are the symptoms of pyelonephritis? Option 1, fever. Option 2, dysuria. Option 3, nausea. Option 4, flank pain. And option 5, periorbital edema. Let me know what you guys think pyelonephritis symptoms would be. And again, it's a select all that apply, so it's going to have more than one right answer. Let me know what you guys think. And I guess since we are halfway through, I can ask my favorite question that you guys also love to answer in the chat. So, where are you guys tuning in from? Let me give you guys some shout outs from all around the country and other countries and other cities. Let me know. Let's see the first one that I see pop up. I see a lot of correct answers. Good job. Great job, actually. And the first city or country I see is Myrtle Beach, South Carolina, from Kendra on TikTok. Welcome in from South Carolina. Oh, I got real southern there. Sorry about that. Utah. I got some Houston, Texas people. We got a couple people from Houston, Texas. Buffalo, New York, the Philippines, Nepal, Canada, Montreal, Maryland, Queens, New York, Liberia, Cameroon, Georgia, Queens. We got a lot of people from Queens tuning in today. Canada, Ghana, Canada, Norway. Okay, here we go. Now we're going across the pond. Kenya and Brazil. More Brazil, more Philippines. Zimbabwe. St. Lucia, Saudi Arabia, Nepal, Nigeria. Where else? Kenya, Ohio. Love seeing all these different places from all over. Makes my heart happy. Love that UWorld reaches all across the world. That is our purpose, and I'm glad you guys are tuning in. Let's figure out what the correct answer for this one would be. While you guys are still putting it in, I'll give y'all shout outs later. Options 1, 2, 3, and 4, nearly all of them. Pyelonephritis. What is pyelonephritis? That is just an infection of the kidney, usually from causing from a UTI, and it's coming back up from the bladder. So with bladder infections and kidney infections, you have fever, dysuria, nausea, and flank pain. Periorbital edema is not something that we would see really with anything pyelonephritis or kidney related. So that one was just an outlier. Periorbital edema is swelling around the eyes. But you guys did good, pretty much everything. If you have an infection, if you are feeling inflamed, you're usually going to have fever, dysuria, nausea, and flank pain, especially with the pyelonephritis. That is your lower back pain where the kidneys are located. Good job, guys. Question 5. The nurse is providing discharge teaching for a client with benign prostatic hyperplasia. Which of the following statements by the client would require follow-up? Option 1, voiding every 2 to 3 hours promotes bladder emptying. Option 2, the condition increases your risk for bladder infections. Option 3, decreasing caffeine intake can help alleviate symptoms. And option 4, limiting your daily fluid intake helps prevent incontinence. Let me know what you guys think, and I'll go back to shouting you guys out. Leon on YouTube just passed their NCLEX with 85 questions. Congratulations, that's awesome. Good for you. And then we have a couple people from Nigeria tuning in, Maryland, correct answers piling in. It's getting past me now from all over. Correct answer choices. Australia, Kenya. Someone says, congratulations, I'm next in line. You are next in line. You will be passing. Good job. Lots of great answers. Great answers for this question. Also, I didn't see anybody tuning in from Seattle, but I would love to let y'all know and to reiterate that we are partners with the NSNA, which is being hosted in Seattle. So me and Samantha will be at the NSNA conference here in April, and we would love to get to meet you guys. We are doing live lectures there at the conference and doing the question drills. So we would love to see you guys. If y'all are a part of the NSNA, come say hi at our booth. And yeah, let's see. Let's go to the correct answer for this one. Option 4, limiting your daily fluid intake helps prevent incontinence. So again, let's go back to the question and figure out what our key words were. In this case, we are requiring follow-up. So again, another wrong answer or a wrong action or wrong teaching point. So all 3 of these would be correct teaching points of benign prostatic hyperplasia, or BPH, which is when in the male clients, their prostate just enlarges and it kind of presses down on their urethra, so it makes them have a harder time urinating. So if that flow isn't good, they can backtrack their urine and get UTIs very easily. So we want to do good teaching on UTI teaching and prevention, and correct bladder emptying prevention or teaching. So limiting your daily fluid intake will help prevent incontinence. This is actually the exact opposite of what it would do, or what we want to teach them. We want to encourage them to drink fluids so they can flush their system out and make sure that they are emptying their bladder completely, because if they do have keep a little bit of urine in their bladder, then it can cause them to have UTI. So we encourage a fluid intake to help flush out that bladder. Options 1, 2, and 3 are correct teaching points. You want to teach them to void every 2 to 3 hours for bladder emptying. Option 2, the condition increases your risk for bladder infections. Like I said, that enlarged prostate pushes down on the urethra, causing the backtrack of urine into the bladder. And then option 3, decreasing caffeine intake can help alleviate the symptoms. Like I said again earlier with one of the questions, caffeine can be a diuretic. So then it can make you have to go urinate a lot. So we want to decrease that effect by limiting our caffeine intake. But good job, guys. Next question. The nurse is caring for a client who had a transurethral resection of the prostate 8 hours ago and is receiving continuous bladder irrigation. The urine in the drainage bag is dark red and viscous. Which of the following actions would be a priority for the nurse to take? Option 1, document the findings. Option 2, decrease the irrigation flow rate, or increase the irrigation flow rate, I'm sorry. Option 3, remove the indwelling urinary catheter. And option 4, use sterile water to manually irrigate the indwelling urinary catheter. Let me know what you guys think. Somebody said that I read it wrong. I don't know if it's this question or the last question, but yes, always very important to read the question very carefully and point out what those keywords are in the question. That will literally make or break you on that question. Let me know what you guys think for this question. And then Samantha asked a fun question this morning. If y'all didn't know, we also go live on Thursday at 11 a.m. Central Time. She asked what you guys' favorite scrub brand is. And there was a lot of figs in there. But nowadays, I feel like there's so many types of brands of scrubs. Figs. I heard Fabletics has scrubs that are really stretchy. The TikTok shop has scrubs that are really nice. Where do you guys like to get your scrubs nowadays? Or do y'all just like to go the cheapest route? When I was in school, I used Grey's Anatomy a lot. I don't know if that's still around. It was really nice. But now I feel like I'm turning into a figs girl. But now the prices of the TikTok shop is enticing. You know, I'm all over the place. Let me know what you guys think. Couture. I've seen Couture. I haven't tried it myself. Mandala. Haven't tried Mandala either. Where else? Any other scrubs? Or a lot of people are stuck on this question. So I see a lot of 1s and 2s. The main thing, we're looking for a priority. So if something is, you could only do one thing that could potentially save their life, what would you do? Someone said the Grey's Anatomy are good quality. Okay, great. I'm glad I was wearing some good scrubs then. Okay, the correct answer for this TERP question is option 2, increase the irrigation flow rate. So a TERP, or a transurethral resection of the prostate, is something where, or a procedure that they do to take a piece of the prostate and then they insert a 3-way catheter Foley to do the continuous bladder irrigation. And with that, it's usually a nurse-driven order to keep that bladder irrigation going so that the urine is light pink, not dark red and viscous. If it's dark red and viscous, that means that it is not flushing and cleaning out the bladder as well as we want it to be, and that you have an increased chance of getting more clots in the bladder or in the urethra, and that can cause even more problems, which we'll need to irrigate and do other things later, and the surgeon would be very, very mad. So the nurse-driven thing to do would be increase the irrigation flow rate to get that fluid in the bladder and help clean it out. And then we want it to be light pink or clear as you irrigate it out. So increasing that irrigation flow rate would be the correct thing and the priority to do. Option 1 usually is not the answer choice. You're never usually just going to leave something alone and just document what you saw. There's usually always going to be some type of action that the NCLEX or the question is asking you. That you want to always do something. If it's assess, if it's monitor, you want to do something, not just, I saw this. So that is why option 1 is incorrect. Option 3, remove the indwelling urinary catheter. Please don't do this. Your surgeon would be very, very, very mad. Not unless you have an order, but if it's dark red and viscous, that is even more reason to keep that catheter in there and fix the problem, which would be increase the irrigation or to irrigate the catheter. And then option 4, use sterile water to manually irrigate the indwelling catheter. That is something we would probably do next if we had an order to do that. But the first thing, prioritization to do, steps 1, 2, and 3, first increase the rate, see if that helps. If not, get an order to irrigate it. And maybe a clot is blocking it off, so we might need to, kind of pump and push that clot off. So option 2 would be the correct answer. We got to increase that flow rate. Good job. Question 7, the nurse is performing peritoneal dialysis for a client with chronic kidney disease. Which of the following actions should the nurse take? Option 1, chill the diastolate prior to administration. Option 2, perform the exchanges using clean technique. Option 3, maintain the client on bed rest during the dwell period. And option 4, check the client's serum potassium level prior to instilling the diastolate. Let me know what you guys think. Oh, and I can go back to my scrub questions. Someone said that they used Fabletics and they said that it was good. So I actually might try that. I like very stretchy scrubs. Miss Alina on Instagram just passed her NCLEX also in 85 questions. Congratulations to you. That's awesome, awesome, awesome. Good job. And then somebody was asking why option 4 was not correct in question number 6. I'm sure Samantha is getting you that answer because I already forgot what option 4 was. So she will answer that for you. Give her a few moments, but keep those answers coming for this question. We are performing peritoneal dialysis. What should we be doing? What's a good action to be doing? This is a positively worded question, as I would state. Which of the following actions should the nurse take? So we're wanting to do one of these answer choices. One of these answer choices is best practice. Let's say, correct answer, option 4. Check the client's serum potassium level prior to instilling the diastolate. So peritoneal dialysis is a type of dialysis that clients do oftentimes at their home, but they can also do it in the hospital. But it's where they do the kidneys work by using the abdominal membrane. So they put some diastolate in, it mixes in with all the toxins, the waste, the electrolytes, and then we drain it all out. This is a nice option for people because they can just do it overnight, but they do it every single day instead of doing that Monday, Wednesday, Friday schedule with hemodialysis. So it's a fun or fairly good option for some clients. But the main thing with pretty much any kidney disease or any type of dialysis is you want to make sure your electrolytes are within normal range, or just know your electrolytes in general, so that you can give yourself the diastolate, the correct concentration, but also so you don't give yourself too much potassium and cause cardiac problems later on. But you need to check your serum potassium level before so we can know what type of diastolate we need to be instilling. Option 1 is incorrect because we actually don't chill the diastolate. That would cause abdominal cramping and be uncomfortable for the client. So we actually just keep them room temperature. Option 2, perform the exchange using clean technique. This is dialysis, and they are prone to infection and prone to, it's like an, not open procedure, but we're using open tubes that is messing with your insides, basically. So you are at a high risk for infection. So we actually use this sterile technique for any dialysis exchanges. And then option 3, maintain the client on bed rest during the dwell period. This is actually, during the dwell period is actually when they can move around and do whatever they need because that diastolate is mixing in their body. And so they can actually be moving around and doing whatever they need to be. They do not have to be on bed rest while they're on the dwell period. So that is why 3 is incorrect. So check your electrolyte levels before any PD exchange. But you guys did great. Last question of the day. The nurse is assessing a client who has a urinary tract infection and is receiving benzopyridine hydrochloride. The nurse would expect the client's urine to be what color? Option 1, bright yellow. Option 2, light orange. Option 3, dark brown. Option 4, pale red. I didn't mean to give away what it could not be, but you guys let me know in the chat. What color do you think your urine would be if you're on this medication? Let me know. Last question of the day. Let's see if we can get it right. Also, let me know how well you did out of 8 questions today. How many got 8 out of 8? Love to see that. Next week, we got some good topics to go over. We listen and we do judge. You guys let us know that you wanted some more kidney information. So we are doing, or Samantha's holding a lecture on Tuesday about chronic kidney disease. That would be great for you guys to tune into. That is Tuesday at 12. And then you guys also really wanted EKG prep. So we are doing an EKG question drill on Wednesday, I think with Jackie. So tune in on Wednesday for that EKG. And then Thursday, I'm doing oncology. So lots of good random things, but things that you ask for. We listen and we judge and do. So let me know also how well you guys did out of 8 questions today. I see lots of 7s out of 8, 7s out of 8, 5s out of 8. That's okay. Tune in every week. We'll get better each time. Correct answer for this one is light orange. Benzopyridine is also just azo, or just over-the-counter medication that is used to help treat urinary tract infections with pain and burning and all that stuff. And it makes your urine, not even just your urine, but your urine, your sweat, sometimes a little bit even your saliva, a light orange color. So it's something that once you see it, you probably won't forget. So this is just a knowledge-based question. All the other choices, that looks like dehydration, and some obstructions going on under there. But you guys did good. That was an easy question to end the question drill today. I hope you guys learned something. Take some tips that we learned today and use it as you practice throughout the whole week. I wish you the best of luck this week. For everyone who's taking your NCLEX this weekend, next week, whenever, soon, good luck. Congratulations to all the people that pass. And I guess I'll see you guys next week. Bye, guys.